All right. Well, I have 9:02, so we'll go ahead and get started. Happy Friday, everybody. Thanks for being here with us. We just want to share some information with you related to kind of the transition with the nursing assistant program from Castle Branch to Viewpoint screening. I just wanted to do some introductions here. I'm Kevin Foley. I'm the Associate Dean in the Madison College School of Nursing. Um, and we've been working on this project for about a year, so I'm super happy to kind of get this ball rolling and hopefully in better service to all the students and all the school districts that we work with through Madison College. I'm gonna have my team kind of introduce themselves who are on the call with us as well this morning.
I'll go. I'm Terry Gorder, Department Chair in the School of Nursing. I'll hand it off to Renee.
Hi, I'm Renee Helen. I'm the Nursing Assistant Program Director.
Good morning, friends. I am Carrie Kleminski, currently serving as the Dean for our School of Nursing. And thank you for those of you that helped me out with our DHS visits. I really enjoyed visiting your labs and getting to meet you.
Hi, I'm Jen Schneekloth, Administrative Assistant here at the School of Nursing at Truax.
I see Alkeisha, I see Alkeisha's on too. And then
her mic was muted. Sorry.
I know. Can you guys hear me now?
Yeah.
Hello? Oh my goodness. I did the whole spill too, so sorry about that. Didn't know you guys could hear me. So good morning, everybody. My name is Alkeisha Lang. I am the clinical coordinator here at Madison College for the Nursing Assistant Program.
I was wondering, Jeremy and Emily, could you come on and just introduce yourself real quick as well if you're around? Thank you.
Good morning. I'm Jeremy Walden. I am a senior advisor with Early College. I cover 22 high schools, mainly our eastern region, and all the surrounding non-MMSD metropolitan schools for Dane County. I do all the in-school cohorts that aren't MMSD as well. So.
Good morning. My name is Emily Hellberg. I'm an academic advisor with Early College, and I cover all the schools Jeremy doesn't.
Awesome. Well, thank you, everybody. I have a short PowerPoint presentation that I'm gonna go through, and then we're gonna just do some show and tell in viewpoint screening, so everyone can just get a sense of the new system. So the first, why I just wanted to, first we just wanted to talk about kind of why we're making this change. Really, it comes down to improving the student experience. We know that nursing assistant is in many cases, it's the very first course that students take with Madison College. And we want to make sure that, we're doing whatever we can to make that process as smooth as possible. It is complicated to get all of the health requirements completed, for the nursing assistant program. But we were having a lot of issues with Castle Branch, quite frankly, for many years. And so we started exploring options. Honestly, like it was probably more than 2 years ago is when we started like exploring different options. And then just in talking with other colleges, other stakeholders, and exploring different products, we really saw that viewpoint screening was going to be able to improve our student experience. As I mentioned, we've already piloted this program for about a year, and kind of just what we're seeing so far in the past year is that it tends to be a little bit more user-friendly platform, better customer service. There's a chat function that's very helpful for both staff and students. I can kind of show you that once we get to that point. Um, and that's been a way for students to get just more immediate answers to questions that they have, faster turnaround times, reduce student errors, specifically with the bid form. And as I mentioned, we have been piloting this for about a year and just in discussions with our sister colleges, our WTCS sister colleges. Most of them have made this transition to viewpoint screening. I did want to just mention and be transparent about the cost. There is a cost increase. Our previous package was like $66, somewhere in there. The cost for viewpoint screening is $83. However, one of the benefits is that there's more transferability to our other nursing programs. So when students are going into practical nursing or associate degree nursing, they don't necessarily have to purchase like a brand new package and spend that $83. It would be a reduced cost for them. So that was one of the benefits that we saw in going with this product as well. So our current status is that our Castle Branch package, which was that MJ17, that has been deactivated. So students can no longer order through Castle Branch. Our viewpoint screening is available for purchase. We have updated our website, the Madison College website, with links, and we are working on student instructions, getting those out to everybody as well. Currently, the college is working through like an accessibility project where all of our PDFs have to have a lot of like accessibility components to post on our website. So we're kind of working through that to get that up on our website. In the meantime, I can just share it all with you via email, the instructions. Um, and I just want to be clear about this is to enroll in our spring 2026 semester. Um, Students will have to have that Viewpoint account. We can no longer accept Castle Branch for spring 2026 and beyond. Um, Also, I wanted to point out that some high schools who are collaborating with Madison College on CNA programs have set up a structure where they're being invoiced for any students who are associated with their school district who are going through the nursing assistant program. For this specific, there's going to be kind of a different link. And for those of you who have that set up, you should have that link. I can also share it with you, and there will be specific student instructions that your students will follow. For those of you who have set up the invoicing agreements with Viewpoint. I know that I'm still working with a couple of school districts to get this set up. We will be in touch about that. I know many of you, I've been in touch with the folks who are getting that set up still. And if you're interested in getting that set up, please let me know. We can kind of connect you with Viewpoint to work on that. Go ahead, Jeremy.
Yeah, just since you're on this, I'll do it now. We are also kind of shifting a little bit of how your students will, because we have more and more schools doing this with new Viewpoint, there's going to be a little different experience for them from our office. They will still receive all the emails they have before, but we also have had the nicety of moving to a new online course system and Brightspace with us this year, which allows us to actually enroll students into a course once they have a Madison College ID. And so instead of having our technical systems build, I think we're up to like 7 or 8 different schools in our system to send emails to each student individually, they will actually be instructed to log into Brightspace, where they will be assigned into a class based on your school. And that's where they will find each individual school's instructions. So that way they will not get confused by getting the wrong school's link or will have issues with that. It will be built that way. Emily is actually an instructor with us this semester and has been doing work on building that for them. The other nice thing we are doing is it will have a checklist for them in there as well. So when they think they're done with the spot in Brightspace or in Viewpoint, they will go into Brightspace and said, I've done this. So Emily and I can see that what they think they've done, and then we can compare it to what we're getting from the nursing assistant staff on our couple weekly updates to see like, is the student actually doing what they're thinking? Have they thought they've done something they're not? So that way we can have a little better communication back and forth with the students as well. And of course, Emily and I are both happy to come out to the schools to help work with the students, especially as we make this transition, as well as you, so you're not out there alone, kind of navigating the new system. So it will be just a little bit of different experience, and the fact that they're not just going to click on a link and it's going to take them to their individual instructions. It's going to have them log into their Madison College account to get their instructions. So.
Thanks, Jeremy. Alrighty. So, the next thing that I wanted to say is just related to the requirements. So what's important for you all to know is that the health requirements are not changing for the time being. So Viewpoint will have the same exact, requirements that Castle Branch had in the system. So from that point of view, nothing is really changing. Some things will be slightly different, and I'll show you like how the process of doing the bid is a lot different than how it was in Castle Branch. It's more electronic version versus like printing out a piece of paper and filling it out, as well as the health insurance. So I'll show you that, but overall the requirements will remain the same. All right, so I'm gonna go ahead and get into showing. So let me see if I can. I'm gonna put this is the link for the main Madison College viewpoint screening is I just put it in the chat there. It's viewpointscreening.com/Madison College. And then you will get a screen that just looks like this. Notice that there's a chat function in the bottom right hand corner. And so at any time, if students are having challenges with uploading things, or if something is rejected, or if they have a question, they can always click here in this chat, and they can put in their name and their email address. It kind of auto-populated mine since I'm logged in. And then they can ask a question, about like health portal documents, for example, or just click on other assistance. And there's during business hours, there's somebody to assist with students. If it's after business hours, um, it goes to a general email, and then the viewpoint screening folks follow up the next day. But basically, students will just click over here on start your order, and then they will click on nursing assistant. Um, and really, the students just need to do this background check and health portal. Um, Students do not need to do the drug test unless they're asked to do so. So that's important for everyone to know. So at this point, just the students will just have to do the background check and health portal. Once you get to this screen, it just says that you're placing an order for nursing assistant. Please confirm. And then it's going to tell you kind of about the package, the cost, and kind of the terms of use there. And so the students will go down and have to agree to the terms and refund policy and click next. And then sometimes we have students who ask, they might have created an account in the past. And so, 2 years from now, once we get to that point, if students are unsure if they already created this, they can enter an email and check to see if they have something already created. If not, they'll just leave that blank. And then what I really wanted to show you all here is this Wisconsin bid form and how it's kind of different in the new system. If you click here to complete the form, it takes you to basically this is one of the big things with Viewpoint and how it's different from Castle Branch is that the bid form is kind of completed electronically. And so you'll kind of go through this with the student. Um, select you need to make sure that students select the student/volunteer box for this, and then students will enter their information here. So I'm just gonna do as like I'm gonna pretend that I'm a student here, and they'll have to add their date of birth here, and their address. Um, and then one thing that I just wanted to show too is that's really helpful is if you try to go on at any point without typing in one of the required fields, it's going to kind of stop you and tell you that to verify all your fields, and then it's going to highlight the fields that are missing and tell you to enter them. And then the students will answer the questions here related to their background. For the sake of this, I'm just going through here and clicking no for all of these. And then at the bottom, students will have to put their initials and kind of an e-signature, as well as the current date that it was submitted. And then you'll click on where it says submit form. And then it's going to ask you to, if you have confirmed that everything is correct, please continue. So it's asking you to check your document for accuracy. So you have to click on this and it brings up a bid form that's populated with all of the fields basically that I just filled out here. You can see. So this is what will be submitted with the student's order. It takes a second for it to populate. There it goes. So the students will just look through here, make sure everything is correct. Once they, check that document for accuracy, they can go ahead and press continue. One important thing to know is that if there are aspects of the bid form that is not accurate, honestly, what we're seeing is if students do not put their correct legal name or their correct date of birth, that's where they will have some issues. And what happens is Viewpoint will basically reject their bid and then send they will charge an additional $5 for the students to fill out a new bid basically. So they'll send an email to the student, and there is a $5 charge for that. And they tell them to kind of fill out a new one. The bonus with this is that or the helpful thing is it's a lot different than Castle Branch in that there is a lot of like fail safes to ensure that students are filling out the form completely with that, and then it's not letting them move forward or submit it without some of those required fields. And so if students do not put their correct legal name or date of birth, that's really where they're going to run into issues and have to resubmit a bid. Okay, the question is, will they reject if you don't put NA for former names? No, that is not considered one of the required fields for this, Annie. And yep, or leave the business name blank. Yep. So those are not, so these are kind of what we're figuring out is those things are not considered required fields. And so that's the difference with how Castle Branch was reviewing these bid forms and how Viewpoint is processing these forms. And so for business name, we are still encouraging people to put Madison Area Technical College. But we have looked through several students and they're all being processed, even if those fields are blank. So that has not been an issue. Thanks, Annie. I know that was a big headache for a lot of people with the old system. So then you'll press continue, and then the students will just go ahead and continue and fill out all of the required information here. For Social Security number, we are really encouraging students to use their Social Security number in the case that students do not have a valid Social Security number. It notes on here that students should enter all zeros instead. So I wanted to mention that as well. Um, Date of birth. I'm just going through this, so. One other thing that I wanted to mention is if you could please have students put their Madison College student ID number in this field, that is very helpful for us because basically that we pull a lot of reports and it's really helpful to have that information. Sometimes we notice that students put the ID from the like I think a lot, school districts have different, sometimes it's a 5-digit ID number, a 4-digit ID number, but the Madison College is the 7-digit, and that's really helpful if the students put that. Kitty. Um, Alrighty. So then after you fill this, you'll just click on next. And then it basically takes you to a payment screen. For those school districts who are being invoiced, this won't appear. It will just go through, a different process, and it'll make a note that your school district will be invoiced for that specific student. Um, I'm just going to stop sharing here for a little bit because I'm not going to fill out the payment information. It's pretty straightforward, but I did want to go and um, log into the health portal so I can kind of show you what that looks like as well. All right, let's see here. I think Creed has a question as well. Should students use their personal emails or Madison College emails? Um, I would just say whatever email, or Creed, let me up you one. Should they use their Madison College, their personal, or their school district email? Would be the other question there. And my answer is whichever one they're gonna check more frequently. Yeah, Terry, what do
So
you
my
think?
I would suggest not the high school email, because if they are planning on using this in the future and they're connecting them through email address, once they graduate, they will no longer have access to their high school emails if
Mm,
they do want to continue to
mhm.
use their account. So
Yeah.
that's the only one I
Yeah.
would suggest not using for that reason.
Hmm.
I wouldn't want somebody to have to pay for a new account later because of that.
Yeah. Yeah, that's a good. How long do students have access to their high school email? Is it gone as soon as they graduate? Usually I'm seeing Denise say yeah.
Yeah, pretty, it's pretty quick. You
Yeah.
use, sometimes we're lucky and they can get it maybe to August or September, but generally, at least in our district, it's pretty
Yeah.
quick. Mhm.
Great. Let me just share my screen here again. Um, all right. So once uh once you have your account kind of created and have gone through that process, this is kind of what the screen looks like that students will get. Again, there's always the chat in the bottom right-hand corner. Really, what students are going to have, they won't have drug testing unless they ordered it. Really, they're going to have this health portal and view results in there. And so they'll want to go to the health portal. And this is really where it shows all of the requirements that were basically in Castle Branch. So COVID-19, functional abilities, health insurance, influenza, MMR, tetanus, TB, and varicella. Um, and then at the bottom, there is a note for health portal messages. So anything that gets rejected or any messages from between Viewpoint and the student will show up down here. If there was any communication between Viewpoint and the student, it'll show kind of the date and what the message was. Um, also, if you just click on the requirement here, it'll bring up kind of a description of what the health requirement is and how to meet that. Um, so you can kind of go through and look at the students can go through and look at that. Some of the ones too, like functional abilities. There's actually a form. So it says here students have to upload the functional abilities form with marking yes with a signature and date. So you can actually click on that and it'll bring you to like a PDF file. Um, and this is the functional abilities kind of to enroll in the nursing assistant program. So that just needs to be reviewed. And then at the bottom, there's a kind of yes, no checkbox, signature and date. Um, we just found out, so we can do digital signatures on these things as well. And so um, if you know how to get the students to sign using Adobe PDF, date it, check the box, and then you'll have to save the file and then upload it. So I know that that was a question that we got earlier this week as well. Um, okay, let's see here. Okay. Um, okay, I clicked the wrong button here somehow. Let me stop sharing for a second. Okay. Um, so the rest of the, health requirements are pretty straightforward. Not like I mentioned, nothing has really changed. The one thing that I wanted to mention was related to health insurance. Um, so in Castle Branch, we were not collecting health insurance documentation, and we found out that we really need to ensure that our students have health insurance specifically while they're in clinicals. And so that is one of the changes that we had to make with Viewpoint, is that students will have to provide a copy of their current health insurance card or proof of coverage. If students do not have coverage, we do have an option through Madison College that students can purchase. That is through Gallagher. It's $15 for a semester and really covers um, students for accidental insurance while they're at the clinical site. And really, that's just to help protect the students if in case anything happens in a clinical setting. um so I wanted to mention that, as that's kind of a different. I see there's some dialogue about COVID here as well. I know that's been like we've been getting a lot of questions about COVID. And as Terry mentions here, we are still being asked to collect all of the COVID 19 vaccine information because we have to sometimes report which students were given that in the past. And we know that students are having difficulties getting any updated vaccines. And so we will accept it. The system accepts any old COVID vaccines that they might have had in the past. So that will get marked as green if students have that. If they never got COVID vaccines, there's a waiver process. And Terry kind of helps lead that with the School of Nursing. And so that will be a similar process that we've used in the past. Um, all right. Well, the last part of this is really just I put some FAQs that we got with and we kind of already mentioned the COVID. Unfortunately, for students who have already purchased Castle Branch accounts, if they have, Castle Branch accounts, unfortunately, that, as I mentioned, will not be valid for spring. And so students will need to purchase a Viewpoint screening account. And then I guess the other thing is just what assistance is there to help with the cost of purchasing a Viewpoint screening account. And I don't know, we have some programs here at the college that do help students on a case-by-case basis. I think most of those programs, like Work Smart, a lot of them, they do have some youth programming, but I think it tends to be more for adult students who are 18 years and older. And so I know some of the school districts are helping students pay, but I don't know if there's other resources like within your school district to help students pay with that. Um, but that's kind of the other like question that we're getting. And so if there's any resources, feel free to throw them in the chat that you might know about to help, students who are having difficulties. Um, So that's really, what we wanted to share with you this morning. And so we can save the rest of the time here for any questions that folks have about either Viewpoint screening or just the Madison College Nursing Assistant Program in general. We really want to thank you. Yeah, Carrie, Kleminski, our dean, was out at a lot of the high schools, and she just said how awesome it was to connect with all the partners and see, it really takes a village, and we really appreciate all your partnership, collaboration, in getting the students connected to really a transformative program. So we'll hang out here for a little bit, in case folks have questions. Feel free to throw them in the chat. If you're busy and need to go about your day, that's totally fine as well.
I'm gonna just jump in and share that
Yeah.
because I did a lot of the one-on-one with Renee at DHS, and she could not compliment our high schools any more than she did, as far as how friendly and welcoming, and the spaces are amazing. She sees, all nursing assistant programs across the entire state, and she was beyond impressed. So thank you. Appreciate it. And we did get our program renewed for the next 2 years, thanks to all of your help. So thanks.
Yeah. So, okay, Creed, that's a really good question. Will school-based staff have access to administrative accounts? Yeah, those of you who have like your own specific invoicing system with Viewpoint will have administrative access, so you can monitor students' progress and see what's outstanding in terms of health requirements for them. So, oh, perfect. Oh, that's a great picture.
We took pictures at every single lab as we went through. So I just thought I'd share them with everybody because your labs and your people are included here.
Thanks, Noah. Take care.
I have a quick question.
Yeah.
I just wanted to know, I know with Castle Branch, sometimes it took a little while to have the communication between Castle Branch and Madison College.
Yeah.
So, that was a tricky part. So a lot of times I worked with Jeremy to try to get my students enrolled before they actually had all of the information inputted in um,
Yeah.
Castle Branch. So I'm wondering, is that more seamless with Viewpoint?
Yes, yes. It's the students, what we're seeing is um the health documentation is reviewed within 24 hours and either approved or rejected typically. So we have seen just the faster turnaround times and more responsiveness. Yeah.
Okay, okay. And so the 2 TB test is still the one that's still going to be required, correct?
Correct. Yeah.
Okay.
And that is kind of a federal legislation thing, with long-term care facilities. And so unfortunately there's not a way around that.
No, I get it. I'm
Yeah,
not
yeah.
placing blame. I just know that
Yeah,
working with high school students,
that
sometimes that's a
is
pain in my fundi.
yes. I feel you. I hear you. That
Yeah.
is absolutely.
So we would love to get that whole requirement gone, the two-step, but we can't because like Kevin said, it's a federal requirement. Even at the state level, it would be really nice to get that changed. I don't know if anyone's ever really explained and why it's a two-step, because it kind of feels pointless. And I think students get really frustrated, and I often get phone calls from parents and, well, they already did one, why do they have to do two? And just so that everybody listening here kind of understands, the purpose of a two-step is you do the first one, and if someone has like TB, but they don't immediately react, the whole idea is that the first one actually activates the immune system. So the second one is what then shows positive. So there's actually rationale behind it
Yep.
from the medical standpoint, but yeah, I believe, I agree with you. Frustrating beyond belief. It's
Yep,
a lot of
no,
visits.
Yep, no, I totally get it. I'm
Yeah.
really not, yeah, it's just, yeah, unless I physically take them to the doctor's office to get it done, sometimes they're just, but it's ultimately it's their education and their choice. So if they want the class, they got to do it. So it's up to them. But no one ever explained that piece though, Terry. So that's helpful because sometimes it's hard to, when I have facts that I can explain to students, then it makes a little bit more sense as to the why.
So I'm gonna also throw this out there because I learned this when I had to go get mine. And I'm not promoting this, but I'm assuming that all the schools have a school nurse. Am I correct?
We
Okay.
do.
So
Yeah.
I went to my local county public health to get mine, and they were more than willing to hand me my form and have another RN read it so I didn't have to come back. I am not sharing this like I guarantee whatever county the students are in, it would work, but I am just throwing this out as it's a potential that potentially could be looked into because I'm not in Dane County. I'm in a different county.
Yeah.
But I'm just wondering if there is a possible way that we could cut down the number of visits if if the public health department would be willing to send those forms home. Doctor's offices are not. It still has to have that it is either from public health or a doctor's office on the form. But I'm trying to find ways so that we can make this a little easier, especially for these high school kids, to not have to do 4 visits.
Yeah.
So maybe something to look into at the different counties. Just a suggestion.
So we would talk to our public health about that.
I would call and ask them the question if they are willing to send, if the students come in and get them with them, if they're willing to send the form with the student directly, that maybe it could go back to the school nurse to then do the reading. I didn't know that was a possibility. My county public health nurse made it sound like it was something kind of new for them anyway, that it was acceptable as of January of this year. So I'm not sure though if it's like across all counties. That's why I'm saying I'm not guaranteeing, but if
No.
this is a potential that would make life easier, it's at least worth looking into.
Yeah. Perfect. Thank you for that suggestion.
And Denise, how did you get this Fireflies note taker to come with you?
Did it come with me? You know what? I have no idea.
Okay.
I have no idea. I have been I've had a few meetings and I'm guessing at what meeting it was in. And all of a sudden I have fireflies everywhere and I didn't sign up for anything. I swear to God.
Oh no. Oh no, you might be being hacked or something.
Well, it's something that tapes or videos or records any of these meetings that I'm in.
Yeah.
And I'll tell you what, I'm not technology savvy, but I didn't pay for anything. So whatever is happening, so I hope none of you get fireflied on because of me. So I'm sorry, I don't know what it is. It's something AI.
Yeah.
So sorry about that.
Can I say, we've been paying for students to get the TB blood draw.
Quantiferin. Yeah.
Yeah. And that has, it's only one visit. That's been really, really important in helping kids, be efficient about getting their TB done. Is that's still acceptable?
Absolutely. Craig, can I
Viewpoint
ask?
goes? Okay.
I'm just going to ask because I don't know. Do you know the cost that it's costing to get that done? The only reason I'm asking is I know that's been a barrier for students otherwise, and I don't know if the price has changed. So that's where I was just kind of wondering.
It's a good question. Meg, do you know the cost offhand? I know I have it in an email somewhere.
I don't, and I think that's just one of the things that we have to consider as well at the school district level is that
Right.
costs go up and we want to make this program as available as possible. And we also just want to consider for whom does that make the most sense. So yeah, we're looking into all these different things.
Yep.
Okay. And I'll bring up the fact too, just so that everyone is also aware that if the student has had a history of having a positive skin test or they have a positive skin test on this round, do not have them go do the blood test. It will also be positive. If that is the case, they need to go get a chest x-ray and have a clear chest x-ray report that is uploaded. I've had a number of students that did this skin test and it was positive, and then they went and paid for the blood test, and I wouldn't want somebody to pay for something that is not going to be beneficial for them. So just that awareness.
Well, I'll send out I'll send out the recording of the thing today. So if you want to share it with any of your colleagues who couldn't make it, and then I'll send out some general student direct instructions for viewpoint screening as well. Feel free to print those out. As needed and provide to your students. It just kind of goes step by step through basically kind of what I showed you during the meeting today. So it's a nice student handout as well.
So I'm assuming that we can give this to, right when you did, we can, I only have 2 signing up for CNA next semester, but our board isn't meeting until the 27th of this month.
Mhm.
So that's not enough time for students to probably do what they need to before November 19th for registration.
Mhm.
So I can give this to them like right away, correct?
Oh yeah, yes,
Okay.
absolutely. Yep, it's available already to log in and create accounts and for purchasing. So
Yeah, Denise, they just won't get stuff from us until we get the applications. So I mean, if you want to head any students off on this or get started with them,
Yeah,
and I mean, most of the districts, I haven't seen very many of you ever deny a nursing assistant. So if you want to get started on some of this earlier, you can give them that. Again,
okay.
you invite us out. I'm happy to work with any students before that point too.
I will be inviting you, Jeremy.
So that, I mean, just know that we will not ever enroll a student
Okay,
until we have an approved application on there.
right,
And
okay.
that students, you as a school, like, I mean, like if your school's paying for it or students are paying for it, know that they might be paying for something that ultimately has not been approved yet. Like those are the things, like, we don't want students to pay for something that's not going to
Yeah.
get approved. As I said, I haven't seen that very often in nursing assistants in any district,
No.
but
Yeah.
that's really up to you as a school if you're paying for it, or you as, we just want students to be aware that this has not been officially approved by the school board and therefore has not been approved for payment to take the class yet.
Okay,
We will not do anything that charges them or want to do anything if there's any gray areas about something not being approved, or
yeah, if it's
we
questionable,
definitely
I
will
wouldn't.
never,
Yeah.
we definitely will never enroll them without that paperwork.
I
So,
gotcha. Yep. Thank you. And I will be contacting you, Jeremy, just so you know.
But I think the biggest thing is they can do all those steps, the getting TB, collecting their documents, and not even purchasing Viewpoint
yeah.
before until that is approved as well. Like there's nothing
True.
having them come in that first day after they're approved, the first meeting we have with them, and having those documents and having, hey, we already have, maybe we've already gone out and we know documents are going to board on this date, so we'll know approval by this date. So let's
Okay.
set up our TB test for the week after that, and then 3 weeks after, and having those all on the books, and having those meetings with those students, let's get this all in line. So once they're approved, we can do step 1, 2, and 3, and then it's just putting them in there. Like the more we can get students pre-ready for once they're
Yep.
approved, and we buy Viewpoint and we get them out there, the quicker the process will work. The
Yeah.
sooner, I mean, I know especially for, Denise, you, and I'm trying to think, see who's all on here that aren't in those cohorts. And I see Greg from Monroe Grove. Like the sooner they're done and the more they're ready, as soon as we have registration open, we can get them those spots and they can make sure they're in the sections that they want. Because especially when we go fall to spring, it's a much quicker turnaround time of when high school students can start enrolling and the general public. In the springtime, we have almost a month to 6 weeks.
Yeah.
In the fall, it's like 10 days. So we'll open up our enrollment for high school students on November 17th. And I believe the general public goes like December 2nd. I don't know. I'm doing this off the top of my head. So like we're talking 2 weeks instead of 4 to 6. So having all that documentation, at least together, is probably a good, that's kind of how the meeting I would have with students would be, is like, let's start collecting this. Once they're approved, then you buy it, upload the documents, do all those things. But
that's a good idea.
Just kind of preload, like, these are all the things you're going to have to do. Let's get those. Because the doctor appointment sometimes is the issue, is communicate. And it's not just getting into it. It's having that communication with the parent, because a lot of students don't know how to make their own doctor appointment. Even though I have a 14-year-old and he has to have his own, my chart, because I no longer can see his stuff because he's 14 and apparently adult enough to do that. That I can still make appointments on him. Most of our students have their parents do that instead of themselves. So getting that to the parents to get those appointments on the book is probably the best thing too.
Okay. And I just read something about October 15th, the flu shot is due. So anyone taking the CNA has to have it by October 15th?
For this semester, for fall semester students. For spring, it would be a requirement of just uploading with the Viewpoint account.
Okay.
Yeah. So students were enrolled in nursing assistant and always are for the fall without the flu shot, because it's not available when they want the current one that comes out in August, Terry, usually.
Actually, this year came out kind of early, like in August.
Yeah, August, early September.
To be honest, I don't even recommend students get it until very late September, early October, because otherwise it's going to be it only stays in your system a certain amount of time. So I always encourage students wait.
So
closer to the due date.
So that's why they get a notification about that, is because all of them are enrolled in the fall without it.
Okay. Thank you for all this information. It's very helpful, and I will meet with my students.
I see Ashley. I think Ashley is from Reedsburg. Tell me if I'm wrong, Ashley. But okay, yep. Okay, great. She's asking if there's a person that would consider to come to the Reedsburg High School to walk through viewpoint screening with students.
Emily is their school's advisor. I do know sometimes we work specifically with, Reedsburg campus is right across the street. So sometimes when you're in close proximity, we will work with somebody from their staff to come with you instead of us. Just be financially from Madison's College Viewpoint, somebody coming across the street is a lot more financially feasible than somebody traveling 50 miles and paying mileage both ways. So I would just reach out, give us, and Emily can still be the point of contact, whether it will be her or her kind of communicating and working with Reedsburg staff to come to your school to do that. We're happy to figure that out and be that liaison. Yeah, Terry loves to go to schools too, so Terry might be able to. Renee's gone to schools. Nursing assistant, I would say, is the one that we have no shortage of people we can kind of get out there if it doesn't work for Emily or I right away on your timeline, as well as we've got a lot of support with, now Keisha's been to schools. I don't think Jen's been to schools yet, but pretty much most of their staff has gone to schools when we need to, so.
Creed, do you have a question?
Yeah, quick question. So I know there's been sometimes like some differences in how when students can enroll based on if they're at the like enrolling at in the school course or if they're going out to Madison College to take the course. And so like for example, we've been able to enroll some students that don't yet have their TB tests fully done in the course so they can get started on it and finish their TB during the semester. Is that something that we'll still be doing or no?
If they're in a high school cohorted section, we have allowed that they don't have to have TB done because we know TB takes longer. If they're in a general population section course,
Right.
Because they're signing up for a weekend course or something else, they need to have that done. We are able to monitor the high school specific sections separately to make sure that everyone has everything done, but to try to monitor students across all of our sections would be very difficult, and we would potentially
For sure.
not have somebody complete. So we will continue that. Of course, we are going to advocate that students have as much done, if not everything done, as much
Yeah.
as possible, so that we're
Same
not
here.
trying to track them down afterwards once they're already in a course, because we do run into students who don't have it done by the time clinical information has to get to clinical sites, and then they can't go.
Exactly.
We have deadlines from our clinical sites too that say you have to have the information to us by this date. And if we don't have it, we have to respect that they're saying nope. So, yeah.
Great. Thank you.
Mhm. Kevin, you're muted.
Yep. We only have a couple minutes left here. You know where to find us all. So if you have any other questions or follow up, feel free to reach out to anybody on the call here from Madison College. We're all here to, support this and try to make it as smooth as possible. So we again we just appreciate all your work with the students, and where our goal is to serve 1,000 students this year, and we're well on our way. And thanks in part to all the work that you're all doing out there with getting students connected to our program. So thank you.